There are over 400,000 hemophilia patients worldwide. However, people with hemophilia can be affected in different ways. Hemophilia treatment has come a long way from on-demand to the current standard of care, prophylaxis. To reduce the risk of bleeding, physicians often consider a prophylactic regimen for some of their patients in order to keep their factor VIII levels above a certain minimum level. However, the ultimate goal is helping all patients reach zero bleeds. When factor VIII is infused, initially the entire dose enters the bloodstream, but it is then used or removed by the body over time. Typically, hemophilia A patients on prophylaxis infuse 2 to 4 times per week without knowing how fast their factor VIII levels are decreasing. The study of what happens to medicines such as factor VIII from when they enter the body until they leave is called pharmacokinetics, or PK for short. It comes from the ancient Greek words that mean drugs in motion. Let's take a closer look at PK. Your PK is like your own personal roller coaster track. Shortly after an infusion, the peak factor level is reached. This is the highest level of factor VIII in the body. Over time, the amount of factor VIII in the body is reduced as it is used and removed. Half-life is the length of time it takes for the factor VIII level in the body to decrease by half. The factor VIII level continues to drop, ultimately reaching its lowest point just prior to the next infusion. This is called the trough. As patients reach this trough, they can be at increased risk of bleeding. Patients treated with recombinant factor VIII have demonstrated significant variability in their PK profiles. So how do you know when your PK profile puts you at a greater risk for a bleed? Since patients may process recombinant factor VIII at different rates, it may take one patient with severe hemophilia longer before they reach the level at which their bleeding risk is increased compared to another patient with hemophilia who may reach the same trough level sooner. Therefore, understanding your PK profile is a critical component of hemophilia care and helps explain why different patients respond differently to treatments. Knowing your PK profile enables your physician to personalize your treatment, along with other key considerations such as age, joint health, bleeding history, adherence, and physical activity. Every individual with hemophilia is different. Understanding these differences and personalizing care are key elements to help put every patient on the right track towards minimizing the burden of the disease in the treatment of hemophilia.